I'm Hallie Hedke, and I'm going to talk about how the utilization of respite care positively impacts the psychological status of caregivers. Although there's always been a problem with mental health and chronic diseases, there seems to be an increase in prevalence with people that are requiring care, especially as baby boomers start to get into that older adult range. So there's currently a huge need of informal caregivers, and that's the more prevalent model of healthcare these days rather than institutionalized care. Currently, about 66 million Americans are acting as informal caregivers, and they are providing support with about one activity of daily living and four more instrumental activities of daily living. And they are providing 90% of care that is required of the care recipient. And this can be a heavy burden for a lot of people, taking a lot of time out of their daily schedules, and maybe taking away their ability to work if they're providing care, or taking away their social life. Collins and Schwartz found that many informal caregivers have higher rates of insomnia, depression, and risk for serious illness. So with this high number of informal caregivers, there can be that high level of strain and burden that I talked about, and so that can really decrease the quality of care that they're able to provide if they're strained, and so that can affect caregiver or care recipients' health and safety. An intervention that has been proven effective is respite care. This can be used on a daily basis or kind of as needed, and it works as the caregiver drops off their care recipient either for a couple hours or the whole day, and then they can go about their day either just kind of catching up on rest or going to work or going out for a social gathering or whatever they need to do to kind of rejuvenate and rest up. So nurses should be aware of respite availability and then also work on detecting caregiver strain, and then should be able to advocate and recommend the use of respite services. So kind of my purpose in looking into this was just kind of to determine the scope of literature available regarding respite services, and then to determine the effectiveness of respite as a means of protecting caregiver mental health. So the literature really spoke to a lot of different things regarding chronic diseases, mental health, both older adults and then also younger children. And so because of that, I really narrowed it down to just dementia and older adults, and worked with 10 articles, 8 experimental research articles, and then 2 literature reviews. So one was a level 2 research article, which was a randomized control trial, and then 7 were categorized as level 3, 4 quasi-experimental, 1 pre-post follow-up in design, and that was a pilot study, and then 2 cross-sectional, and then finally 2 were level 4, and 1 was a systematic review and 1 was a lit review. And each of the articles kind of defined their variables slightly differently, but they kind of all focused on different psychological and physical aspects of caregiver health. So overall, they all showed really promising results, with just a few showing some mixed results, which I'm going to talk about right now. So the randomized control trial developed and evaluated their own home-based intervention. They provided additional support and education with ADLs for the caregiver, and they found a significant decrease in burden and depression, which that's what they had hoped to find, which was great. And this was the one that showed that 64% reduction in risk of death, which is crucial when we have this huge strain on adults or caregivers, and then we're able to protect that by providing respite care. So overall, many of the studies that I looked at found similar results with just showing positive psychological effects. Another study, which is just a little bit of a different form of respite, was by Malvo and Thorsland, and they looked at adult daycare, which is more of like a daily daycare or a daily day program, where you would drop your care recipient off probably like Monday through Friday, 8 to 3 or 8 to 5 or something like that, and you could probably still work during that or take care of your kids, getting them to school or something similar like that. And this one found that caregivers who do not use this, basically don't send their care recipient to this, actually had higher values of role captivity, worry, and overload. So there were significant benefits for those who did utilize this program. And then the pilot study I kind of spoke to before by Jardam and Pakenham kind of showed mixed results, but this one was a little confusing because they did a study that did pre-data collection and then utilized respite and then did a collection at the end and then took away respite and did another collection. And so at that middle collection, there was a definite decrease in burden, which is great, what we like to see. But then at that follow-up after taking away, it showed an increase, which they're saying is mixed results. However, it would make sense that there would be an increase in burden if you were taking away the respite after depending on it for so long. And then finally, one of the systematic reviews evaluated 17 papers looking at kind of different respite services and different lengths and stuff. And 11 of the papers showed benefits to at least one caregiver outcome, and most of them related to stress or burden things. Overall, based on these results, the use of respite care can positively impact caregivers' psychological health. So I've found some reasons that people may not use respite services. People may feel uncomfortable or embarrassed using them, or they may not be able to afford them, or there may be a lack of understanding on how to access them, or even if they're available within their area. So I've developed some recommendations on how we can combat those. So first and foremost, there needs to be some additional research. A lot of the current research is really outdated, or it provides mixed results, kind of like the pilot study that I spoke to earlier, and it is kind of narrowly defined, meaning there's a lot of respite services out there right now, but we can't generalize a lot of the research because there's respite services that are for everyday use or only weekend use or for several hours a day or for all day, and so we need research that speaks to all of those or some of those so that we can be sure that they're all beneficial. And then also, education is key, both for the general public and healthcare members. The general public needs to be more aware that it's available and how to access it, and healthcare professionals need to start being educated in their undergraduate curriculum, not only to detect caregiver role strain, but also how and when and where that their caregivers can access respite care. And finally, I looked into the development of a policy at the insurance level, and this would mandate routine screenings for informal caregivers, both to detect psychological status and just kind of monitor it, and then also just any decline in physical functioning. And then once that reached a certain point, it would mandate that the caregiver sends their care recipient to respite care, and that would be covered by either insurance or a third-party source. And that would just protect any further progression of a disease process from forming. And not only would that save the caregiver money and also the insurance company eventually from treating the caregiver, but also it would just protect the caregiver's health, as we've been talking about this entire time. So obviously everything that I've been talking about is important, and healthcare professionals can feel confident recommending any of these respite services to patients and caregivers. It's imperative that they know and feel comfortable detecting caregiver strain and that they are able to recommend respite services to provide a break for caregivers. Although a lot of this focuses on older adults with dementia, other research is available out there. And as the number of formal caregivers rises and is predicted to rise exponentially in the future years, it is imperative to protect caregiver mental health. Simply using respite services is one way to do so.